Gastroscope is a non-invasive technique that can visualize the extent of lesions in the esophagus, the stomach, and the duodenum. Endoscope-guided biopsy provides rapid and reliable visualized assessment of many disorders. It can take tissue, cell, and gastrointestinal fluid samples for laboratory testing, and can also remove foreign bodies. Next, I will introduce the operation of the gastroscope. The video shows the position of the esophagus and the trachea. Usually, the esophagus is located on the dorsal side of the trachea. Adjust the angle of the endoscope first, then move to the back of the trachea. If you can't find the esophagus, try to inflate it. Usually, if you want to locate the esophagus or observe the stomach or intestines, make sure that the part you want to see is in the middle of the vision. If you still can't find it, try to adjust the direction of the endoscope, or step back a little bit and look at the part you want to see at a relatively further distance. Here is the esophagus near the trachea. Now we know that the distal of the endoscope has entered the esophagus. Sometimes, give some air or water to make the vision clear. You can observe whether there are ulcers, swelling, and other lesions on the esophagus mucosal structures. Observe carefully when we move forward and be sure that the view of the esophagus is in the middle of the screen. Here is the cardia. Then insert the distal slowly and inflate a little bit of air when trying to pass through the cardia. When the cardia is slightly open, adjust the direction to enter the inside of the stomach. If you can see clearly, as said before, step back a little bit and observe where the camera is. It is strictly forbidden to violently operate the distal because it may cause physical damage to the mucosa. After passing the cardia, we can see the interior of the stomach. Sometimes there may be some chyme or undigested food. Just spray some water to get a clear vision. It may be also useful to fill the stomach with some air. Then observe the state of the entire gastric body and the gastric mucosa. Try to do a complete examination of the stomach once the distal is in the field around the cardia.